Okay. So we're doing a deep dive into management of BPPV. Now, remember that we said that the main issue with BPPV is that there are calcium deposits in the semicircular canal, right? And because of that, it causes the endolymph, that is the fluid in the semicircular canal, to lag a bit behind. Okay, good. So, what are the management options? You want to use a management option which looks at particle repositioning maneuvers. Okay, those calcium deposits, you want to, reposition them so that it reduces the dizziness the patient is presenting with. And the common maneuvers we have are Epley maneuver, and we have another one we call the Simons maneuver. Okay, so Epley maneuver and Simons maneuver. Okay, they have a high success rate. And if you remember, we said that Epley maneuver is usually the first line treatment so far as BPPV is concerned. Epley maneuver, Simons maneuver. There's another maneuver we call the Brandt-Daroff exercise as well. Okay, now you can also do what we call postural restriction. After you treat the patient with the Epley maneuver and the Simons maneuver and the Brandt-Daroff exercise, you can use a cervical collar, okay, to keep an upright head position so that it prevents the particles which you've repositioned from returning to the original position. So you can then keep the patient's neck in like a neck collar. Now, you can also encourage them to do some self-treatments at home. And some of the self-treatments are the ones I'm mentioning. The Brandt-Daroff exercise. They have what you call the modified Epley maneuver and then the Simons maneuver. These are movements. Okay, good. Now, what if you see, in your board exam, patient presents with typical vertigo, but then you are told that medications are part of your first line treatment? Remember that Dr. Boni told you that medications are not typically used unless the vertigo episodes are frequent. And one group of medications you can use are vestibular suppressants, and they can help with discomfort during repositioning. And I think one of those kind of medications we call beta histine. Beta histine. In Canada, we call it CERC. Beta histine. In Canada, we call it CERC. So if you see medication in the context of BPPV, don't go for that as your first line. You can only give medication if it's not improving, the vertigo is not improving. And what about vestibular rehabilitation? There's limited role in treatment but can reduce recurrence when combined with recurrent repositioning maneuvers. And usually the vestibular rehabilitation, we send them to physiotherapy. So we have some physiotherapists who have majored in BPPV management. They can help the patient to do their vestibular rehabilitation. When will you do surgical treatment of? Remember that we said that surgical treatment is not our first resort, it's our last resort. It is when you've tried the Epley maneuver, the Simons maneuver, the modified Epley, the modified Simons, the Brandt-Daroff, you've given some medication because of the recurrence and they don't help, then you'll allow an ENT specialist to look at surgical management. But that one, even though the success rate is high, the risk is also high because remember, it's the inner ear, right? So that one, it goes beyond your scope of MCQ1 exam preparation. Now, what is the prognosis of BPPV? Even untreated cases resolve within weeks. So a mean number of days is about 39 days. For posterior BPPV, remember that posterior BPPV is the commonest type, and 16 days for horizontal BPPV. Again, I need someone to tell me what is the difference in the characteristics of a patient who presents with posterior BPPV and anterior BPPV. Who can help me, doctors? Who can help me? Posterior BPPV and anterior BPPV. What's the difference? What's the difference? Posterior and anterior. Who can help me in terms of the way the patient will present? We've learned it. I just want to quiz you a little bit. Posterior
Um,
BPPV and anterior BPPV. Yeah.
in posterior, we have the patient. The patient will have upward and round are eye rotation,
Rotate.
while in horizontal, they will be having downwards and
They can be looking
what is it?
down on the floor. What is the name? We
Horizontal,
said
yeah.
it's horizontal, and the eye can be looking down on the floor, or it can be looking where? Up,
It can be
right?
looking up.
Yeah, beautiful. So, BPPV can recur. Um, about 30 to 35% of them can recur within 3 to 5 years. And this is a very, very important one. Please write this one down. What are the risk factors of recurrence of BPPV? Remember that we said that female sex is more affected than the male sex, right? So, what is the risk factor for recurrence of BPPV? A, older patients, or one, older patients. B, female sex. C, diabetes, or three, diabetes. Number four, hypertension. And number five, osteoporosis. And number six, vitamin D deficiency. This is also a very, very important slide you need to master. A very, 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 very important slide you need to master. Risk factors for BPPV. A, older age. B, female sex. C, diabetes. D, hypertension. E, osteoporosis. And F, vitamin D deficiency. So you should not be surprised. The following are risk factors for BPPV except. So you should be able to know these ones so that you can be able to pick up the except.